Hello, now my name's Dr. Williams. I'm here today to tell you about gallbladder surgeries. When a patient has an ultrasound that shows gallstones, or if they have a gallbladder scan which is abnormal, the best treatment is to remove the gallbladder. Surgical treatment of gallbladder conditions is preferred because there is no good medical management for gallbladder illness. There is no medication that will dissolve gallstones or eliminate inflammation. By removing the gallbladder, the problem is completely removed, and there is very little likelihood that a person will experience problems with gallstones ever again in their lifetime. Nowadays, we have two possible approaches to surgery. The older conventional surgery is to open the belly and remove the gallbladder. The newer type of surgery involves a laparoscopic approach, which has gained considerably in popularity. In a laparoscopic operation, we make 4 small incisions. One incision at the belly button through which we insert a camera, and 3 other incisions which are located just below the breastbone and 2 on the right side. The 2 right-sided incisions are utilized to grasp and hold the gallbladder, and the incision underneath the breastbone is utilized in order to dissect out the gallbladder and cut the tissue. We're able to accomplish all of this looking through the camera in a procedure that usually takes about 45 minutes. The gallbladder is then removed. A patient will return to the recovery room. Because the incisions are small, people have minimal pain and recover quite quickly. Most patients can either go home on the afternoon of surgery or the following morning. Following the hospital discharge, most people are seen in the office in 1 to 2 weeks to be sure that they are eating well, that the incisions have healed nicely, and that they have no recurrent pain problems. Most of the time, people do very well. They take 2 to 3 weeks off of work, and they are very pleased with the outcome because of the minimal scars and minimal pain. Under the more conventional approach, a patient has to be in the hospital for 5 to 7 days, and the recovery period is 4 to 6 weeks because of the size of the incision and the amount of pain experienced. Most patients qualify for the laparoscopic technique. If, however, a patient has had extensive previous surgeries or multiple incisions, this increases the likelihood of adhesions, making laparoscopy more difficult. This, of course, would be explained to the patient in the office before surgery so that we can make the appropriate decision. Whether or not a patient has the laparoscopic technique or an open procedure performed, removal of the gallbladder constitutes a cure of the problem in 98% of cases.